Good morning. This is Dr. Windisch from Sparks Pediatric and Adolescent Medicine again. Today we're going to talk about treating upper respiratory infections in children. Remember that this educational series is not intended to replace visits to your pediatrician's office. And if you have concerns, please make an appointment to see your pediatrician. We'll be happy to see you here at our office. We give same-day appointments to new patients. Our office number is area code 775-359-7111. The question comes up on an almost daily basis in my office. What should we do for our baby who has a cold? Colds are common in babies, unfortunately, especially during the winter, and the babies are flat out miserable. That's without a doubt. Unfortunately, medication-wise, there's not much that you can do. Under 2 months of age, we recommend under no circumstances should you give Tylenol or Motrin to the baby because this could mask a fever. And fever in children under 6 to 8 weeks of age is a very dangerous thing, and recommend that you watch our video on fever without source in children under 60 days of age. Medication-wise, over the counter, under age 6, realistically, there's nothing available. The medications that do exist, there are a handful that are labeled currently for children ages 4 to 6. Those medications will probably be removed from the market in the next couple years. And the reason they will be removed from the market is because A, they don't work, and B, they have a lot of side effects, some of which are nasty. There are drugs that used to be over the counter for children, and they were labeled for kids starting at age 6 months, but those drugs have been removed from the market because, number one, they have a lot of side effects, and two, they didn't work. So if you have some old medications, we recommend that you not use them for your children at this point in time. Having said that, what can you do? Well, there are a few things that will help make your child feel better. First is to run a humidifier, especially if you live in a desert area. My practice is located in Reno, Nevada, and for patients in northern Nevada, we live in one of the driest environments on the planet. Running a humidifier absolutely helps without a doubt. And even if you live in a more humid environment, when your child is sick, running a humidifier many times will make them feel better. Number two, elevate the head of their bed. If they are laying flat, they wind up swallowing a bunch of mucus during the middle of the night. That'll make them gag and sputter in the mornings and many times throw up. Number three, you can use some salt water drops. There's a variety sold over the counter. Your pharmacist can direct you to them. Some of the ones sold today currently go by the brand names Little Noses and Ocean Drops, but there's a billion generics as well, or you can be taught how to make your own. It's pretty simple. A couple of drops in each side of your child's nose helps not only to take the swelling in the nose down, but to loosen the mucus up, and then you can remove that with a bulb syringe, sometimes called a nose sucker. And that helps make the kids feel better as well. I recommend you not suction their nose unless they're uncomfortable. The babies don't like it, and realistically, most of the time the snuffling bothers us, the parents, more than it bothers the kids. If your child is running fevers that do not get better in 3 to 4 days, if they are having trouble catching their breath, if you can see in between their ribs, if they are turning colors, if their cold is not better in a week or two, absolutely call your physician. It's worth being seen, especially if you're having respiratory problems and can't catch your breath. Remember, this discussion is not intended to replace a visit to your physician. If you're concerned, please make an appointment and be seen. If your child can't catch his breath, take him to the emergency room, or if he's turning colors, call 911. If you would like to be seen at our office, we'll be more than happy to see you. Again, we offer same-day appointments for new patients. Our phone number is 775-359-7111. Good luck with this cold. I know it's miserable.